Northwest Norfolk, James Wild, and he joins us now. Good morning to you. You've been campaigning for a rebuild of the Queen Elizabeth for some time. Last month you raised the case again in Parliament. What else have you been doing then to push the case for the QE?
Yeah, well, every day I see ministers. I raised it, as you say, at Prime Minister's Questions last month. I raised it with the Chancellor and his team. I also spoke in a debate with the Health Minister, who's going to be doing the shortlisting process to make the case once again. So there's no doubt every opportunity I have when we're voting in the lobbies to talk to ministers, to say about the urgency of the situation with QEH, the compelling case that there is with the more than 200 props in more than 50 areas of the hospital. I was there a couple of weeks ago talking to the Trust leadership again about the case and the campaign, and I'll keep working with them and with the support of the local campaigners, some of whom I'll be meeting later this morning, to make that case, because we need the investment in QEH.
Well, as we heard earlier, the campaigners are worried that the government won't provide the funding to rebuild the Queen Elizabeth. Are you worried as well, James Wild?
Well, I think we've got a compelling case. QEH have submitted two expressions of interest, one for a single-phase rebuild of the hospital and the other for a multi-phase rebuild. Those bids are being considered alongside, I think, 100-plus bids from different hospitals. So it's a competitive process, but it's a compelling case because the hospital is more than a decade beyond its lifespan. As you've been hearing, working in the hospital with the props is not a good experience for the staff and obviously not for patients either. So it does need to be addressed. It's also important to recognise that there was £20 million given earlier this year, which is, you can now see the fruits of that. The endoscopy unit, £12.5 million. The groundwork is happening on that now. That's due to open in the spring. I saw the new outpatient unit, the Emerson unit, that's going to be opening at the start of next year. And then £3 million has also been awarded for a West Norfolk Eye Centre. So there is money coming into the hospital. When I was there 2 weeks ago talking to the leadership team and staff, there's enthusiasm about those developments. So it's important to also look at the investment that is coming at the moment.
Yeah, you mentioned the new unit there, and the worry is, I think, from people is that earlier this year the Department for Health and Social Care said that any major new unit in an existing hospital could be described as a new hospital, and that means they won't get the repairs done, in the future. I mean, could that mean that this could be called a new hospital?
No, I don't think so. The Trust has put in bids for what they consider to be required at the hospital. They've got the support of the regional NHS in making that case as a priority bid for the area, and that's what the Department for Health is looking at and is considering. The funding that we had this year was emergency capital to deal with some of the most immediate short-term issues that the concrete planks in the roof are causing, so that they can decant from some of the wards and create new facilities. But let's be clear, we're bidding for a major investment in the hospital. That's what people across Norfolk and also the support of people from Cambridgeshire and Lincolnshire as well, working with the MPs from those areas, and we're all making the case that we need to get investment in the QEH.
Well, an announcement is due on 8 new hospitals in the spring. More than 100 different bids have been put in for those. How confident are you that the Queen Elizabeth will be one of those 8?
Well, I think we've got a very strong case. I think we've got a compelling case, and it's what the people of West Norfolk and beyond deserve. The Trust are managing the situation at the moment, but there's no doubt that we do need to have investment. The hospital needs to be rebuilt, essentially, and that's what I'm campaigning for. So I think we've got a strong case. As I say, there's a lot of competition out there, and I have to keep making the case at every opportunity with the Prime Minister and others to make sure we're one of the shortlisted hospitals and then go through as one of the 8, and having the support of local campaigners, people who've signed the petition previously, these new letters, it all helps add to the strength of the case.
Well, elsewhere, this morning we've been looking at what will happen in terms of COVID restrictions after Christmas. Can you tell us any more? What are you expecting?
Well, I think at the moment what we're doing is waiting to see where the data's heading. Obviously, the study from Imperial saying that people are less likely to need to go to hospital with Omicron compared to Delta is encouraging, but it's early data, so we can't pin everything on that. But that's why I think the approach the Prime Minister and the Cabinet have taken and MPs are taking is to wait and see where the data goes. We've put in place some modest measures ahead of Christmas in terms of face masks and COVID passes to get into large events, but we shouldn't be introducing any further measures unless they're absolutely necessary. And at the moment, the data does not indicate or support introducing further measures. So we'll wait and see where the data gets to and whether any further action is needed, or whether the situation we're seeing at the moment, where I think there's around 20 patients in QEH, none of them are in intensive care. If that situation continues and the pressure on the NHS isn't there, then we won't need any further measures. But we will need to be cautious, and of course everyone should get jabbed. There's walk-in sites available across Norfolk. In Lynn, you can go to Shakespeare's Barn today and tomorrow to get your jabs. If you haven't had your first or second jabs, then do get them, or you can make an appointment on the national booking system if you would prefer to have an appointment. And that's the key message. The best thing we can do before Christmas is to get our jabs, because if you're unvaccinated, you're much more likely to end up in hospital and intensive care than if you have been vaccinated.
Well, a lot of people will still be thinking about their Christmas plans. How are you going to be celebrating Christmas?
I'm going to be celebrating with my family, and we'll be enjoying a nice family Christmas. We weren't able to have it last year, so I'm very much looking forward to doing that. I'm taking lateral flow tests regularly, as I expect many people are, and that's a sensible precaution to do. But I think this year we can all enjoy a nice Christmas with friends and family.
Thanks very much for joining us. That's West Norfolk MP James Wild.